The Filipino Culture by Stephanie Beckman. With a large percentage of the Filipino population relocating to America and other countries, it is important as healthcare providers to at least have a basic understanding of this unique culture so that we can best provide them with culturally appropriate care. This presentation will serve as an orientation to the Filipino culture for healthcare professionals, assist in providing a better understanding of the culture for employees, and encourage healthcare professionals to provide culturally diverse care. The primary objectives for this presentation are to analyze multiple aspects of the Filipino culture as a whole, to determine appropriate interdisciplinary interventions for this population, to describe in detail the influences on these individuals' value systems and the beliefs which support their healthcare practices, and to determine issues that are directly associated with caring for this culture. Filipino culture. The culture of the Filipino people can be described as being a tapestry of multicultural influences superimposed on indigenous tribal origins. It can also be noted that the culture of the Philippines differs greatly from cultures practiced in its neighboring Asian countries because of the major influences from both Spanish and American colonization. The Filipino people are primarily of Malayan descent, with cultural overlays and influences derived from Chinese, Japanese, East Indian, Indonesian, Malaysian, and Islamic cultures. Comparison between my culture and that of the Filipino. Starting with language, the official language spoken in the Philippines is called Tagalog, with English and Spanish being deemed as secondary languages. In this culture, the English language is usually used for business and legal transactions and is commonly taught in secondary schools and universities. In my own culture, English is the primary language, and the necessity to use multiple languages for different aspects of business and education is not evident. Family. The Filipino view of family as being very important to them, which is a quality that proves to be similar to the values of my own culture. Both the Filipino culture and my own consider family to be respected, loved, and cherished, and value togetherness. Both cultures emphasize the importance of having close relationships between multiple generations. Time. However, when it comes to time, regardless of timeliness, my culture differs greatly from that of the Filipino way of life. In fact, there is a term called Filipino time, which means that one arrives much later than the scheduled time. I've always been taught, like many other Americans, that if you are on time, then you are late, and that it is respectful and even expected that you at least be on time for scheduled meetings and appointments, or even 15 minutes early. Food. The Filipino do enjoy food and to eat, but to maintain the belief that too much of a good thing can prove to be harmful, and therefore do not overindulge in good food or meals. In fact, in this culture, it is considered polite to leave food on one's plate during a meal. On the other hand, American culture is pretty notorious for being indulging, and to leave food on one's plate during a meal, especially as a guest, can be considered rude or taken as a sign that you did not enjoy it. Religion. The primary religion of the Philippines is Christianity. This correlates directly with my personal religion and the majority of the population of America as well. Cultural aspects. Historical. The Spaniards were original inhabitants of what is now known as the Philippines, and they colonized the country from 1565 to 1898. It was after the Spanish-American War that the United States gained control of the country in the year 1898 and officially named the islands what they are known as today, the Philippines. Eventually, in 1946, the Philippines gained their independence from the U.S. and remain an independent nation to this day. Unfortunately, 33% of the Filipino population live below the poverty level, making the economic prosperity the number one factor contributing to migration to the United States and other more developed countries. Careers in medicine are very commonly pursued, and many individuals are inspired by American health educators who visit the country to continue their education in the field either locally or overseas. Other popular career paths for Filipinos include engineering, technology, and labor. Political. The Philippines is described as being a unitary state, presidential, representative, and democratic republic. The president acts as the head of both the state and the government. The government has three interdependent branches called the legislative branch, the executive branch, and judicial branch. Educational. Americans initially introduced the public education to the Philippines by sending organizations overseas to provide voluntary teaching and training. Today, Filipinos are offered choices between private and public schooling, which generally begins around the age of 7. There are 6 years included in primary education, followed by 4 years of secondary education, which consists of vocational, technical, or academic schooling. The Filipino culture holds academic achievement in high regard and associates higher level of education with success, financial stability, respect, and pride. Many relocate to the United States with goals of pursuing higher education and better careers. The majority of the Philippines is covered in mountainous terrain, with lowlands scattering the coastal region of the islands. The Philippines consists of 7,107 islands, which are located in the western Pacific Ocean and is a part of Southeast Asia. The Philippines is divided into 3 primary geographical parts called Luzon, Visayas, and Mindanao. As you can see from the photo on the left, the Philippines lie to the southeast of Asia's mainland and just north of Australia. Noting this location on a map of the world insinuates the influence that its tropical location has on the way of life and the culture of these islands, making them one of the most plentiful countries in regards to natural resources. The colored photo on the right depicts the 3 geographical locations of the islands, with Luzon being the northernmost set of islands, VCS in the middle, and the southernmost islands being a part of the division called Mindanao. Variances in culture are present between regions. Health interventions. Filipinos have a very significant risk for hypertension. A couple interventions to combat high blood pressure is to encourage frequent doctor visits, and that way any increase in blood pressure over time can be properly noted, or encourage the use of a home blood pressure cuff and allow the patient to record their blood pressure at the same time each day. Teaching the patient ways to reduce sodium in their diet is another key intervention for avoiding high blood pressure due to the Filipinos' tendency to be sensitive to sodium. Type 2 diabetes is another condition that poses a risk for the population. Interventions for this disease include promoting a healthy diet and encouraging frequent exercise, both of which can help regulate insulin levels. Colorectal and prostate cancers are also common among Filipinos, and interventions should include full family history assessment, recommendations for scheduled health screenings and tests. Endemic diseases or conditions describe conditions that occur as a result of one's geographic location or environment. One prevalent endemic condition for this population is hyperuricemia, which is an excess of uric acid within the bloodstream and commonly occurs in these individuals as a result of switching from a Filipino diet to an American diet. An intervention for this condition would be to refer these individuals to a nutritionist who can adjust their diet accordingly, and to schedule them for frequent blood work in order to monitor uric acid levels in the blood. Another endemic disease for the Philippines is called schistosomiasis, which is a snail-borne tropical disease most commonly prevalent in Asia, Africa, South America, and Middle East. The endemic disease species present in the Philippines is S. germanicum, and about 2.5 million Filipinos are directly exposed. Interventions for this disease include to continue studying these endemic areas and continue to practice the control program that was put into place. High-risk behaviors. Three of the most notable high-risk behaviors commonly practiced by Filipino culture include drinking, smoking, and unsafe sexual behaviors, which has resulted in the population as a whole presenting with one of the largest numbers of HIV and AIDS cases. While men are more likely to practice these taboo behaviors within this culture, it is important to provide education and interventions for all Filipino individuals in order to bring awareness to these ongoing issues. Interventions for alcoholism include teaching the signs of an alcoholic, educating of the adverse effects of alcohol, and assisting in setting boundaries and limitations for drinking. Interventions for smoking include providing cessation resources such as nicotine patches and other methods for breaking the habit, in addition to teaching the health issues that can be brought about as a result of the continued smoking habits. Interventions for HIV and AIDS include educating individuals of how the disease is spread, teaching and encouraging safe sex practices, and providing easier access to resources such as condoms and HIV testing. Values. The primary influences of the value system on childbearing practices are that of the Roman Catholic Church and of traditional Filipino family values. These influences encourage common practices and ideas, including that the only acceptable method of contraception is the rhythm method, abortion is considered a sin and is not at all accepted, and family is valued and often grows closer and offers help during time of pregnancy, and women are more so than men will assist in the preparation of the birth of the child. The primary influences of the value system on bereavement practices are that of the Roman Catholic belief system. This influences encourage common practices among this community, such as praying for the deceased and their family, following appropriate behavioral expectations following the death of a loved one, meaning that while women may openly express their emotion, men are generally expected to remain stoic and strong. Additionally, it is expected that black is to be worn during times of grieving. The environment is to remain somber and quiet, and gatherings and events such as weddings should be postponed until the bereavement period is over. Spirituality. As previously mentioned, the most prevalent religion in the Filipino population is that of Christianity. For Filipinos, their version of Christianity proves to be a mixture of Spanish Catholicism, American Christianity, and animistic traditions. Christianity and religion is very important to this population and serves as a foundation for their spiritual beliefs, ways of life, and even influences thoughts regarding healthcare. For example, it is said that Filipinos' primary source of strength are derived from a coveted trifecta, which consists of intimate relationships that are built between the individual, God, nature, and family and friends. A balanced relationship between these entities provide the individual with a sense of strength, comfort, and confidence, and aids in the acceptance of their conditions, whether they are healthy or ill. This relates closely to the magical religious beliefs of the Filipinos, which essentially implies that they never feel as though they are victims of disease or circumstance, and that everything happens for a reason, good or bad, as part of a larger, more important plan or cosmos that has been carefully implemented by the universe. They accept that they have little control over their destiny, trust greatly in their faith and of a more powerful being, and simply allow whatever happens to happen. All of this relates to the healthcare of the Filipino population and the fact that they may not be proactive about preventative medicine or even treatment measures due to their great trust in the higher power and fear of disturbing the way the universe was meant to be. Despite these beliefs, many do still seek healthcare, but remain strong in the idea that their healing is ultimately in the hands of God. Religious customs are important to the Filipinos and are commonly practiced when someone is ill, including saying prayers, bringing religious items such as rosaries for the sick to wear, and performance of daily religious obligations and sacraments. Healthcare practices. While Filipinos tend to be very naturalistic in traditional care, they are also accepting of Western medicine and will partake in acute care measures when necessary. All big healthcare decisions are discussed at length with family members prior to making any formal decision. Things like blood transfusions are acceptable, but the belief that keeping the body intact before death prepares one for the afterlife deters individuals from volunteering for organ donation. The hot and cold theory that many Filipinos believe in provides balance and health in their lives. The hot and cold theory describes perfect healthy environment as being warm, moderate, balanced, and encourages balance and fluctuation in many aspects of life, including both diet and exercise. Filipinos notoriously partake in the consumption of well-rounded healthy diet and only consume enough for nourishment. While Filipinos generally lead healthy lifestyles, they are known to avoid preventative tests and screenings, likely due to their spiritual beliefs and fear of an undesirable diagnosis. Filipinos consider the experience of pain a sign of living an honorable life. They believe that pain is a part of a spiritual purification. This accepting attitude towards pain generally results in a masked expression and stoic appearance even when experiencing great pain, meaning that they won't go out of their way to ask for pain relief measures. As for the sick individual, it is customary for them to allow family members and loved ones to pray for them, include them in religious practices, and participate in their care. Traditional folk medicine remains highly regarded as the primary method of healing and treatment. Examples of common folk practices include religious rites, praying, exorcism, sacrifices being performed in order to appease spirits, herbal medicine, massage, and practicing of the hot and cold theory. Barriers that may present when providing healthcare to Filipino patients include their belief that any ailment will eventually run its course if left alone, economic barriers, religious or spiritual beliefs, and a lack of medically related knowledge. One article, which presents a survey conducted with Filipino participants, determines common responses to perceived barriers for receiving healthcare, with some of the top responses being competing priorities of daily living, lack of personal resources, cultural influences, environmental factors, and lack of access to healthcare services. Cultural issues. Some cultural issues that may present in relation to this culture include the obvious aspect of the language barrier. While many Filipinos are usually taught how to speak English either in school or through their professional business, it is not always expected that they are fluent in the language or that they may interpret the message we are conveying to them in a manner that we hope. Another cultural aspect that may pose an issue is the expectation of gender congruent care from the Filipinos. If a female nurse is providing education and discharge instructions to a male Filipino patient, he may be less likely to take into consideration what she has to say because of factors relating to her gender. Similarly, Filipinos hold physicians in high regard with the belief that every healthcare professional who is not a physician is significantly below them. This may pose an issue in regards to discharge instructions and patient education as well, because it usually nurses and other personnel who provide this aspect of the care and not necessarily the physician. In conclusion, the Filipino culture is one of a unique and rich tradition and one that continues to grow in prominence in our own country, making it an important culture to stay educated on and aware of in our practice with healthcare professionals. These are the references that I used in regards to this presentation, and thank you for your time.